Hi, Dr. Del Grosso, SF Chiropractic. I'm going to talk to you briefly about sciatica or sciatic pain. Sciatic pain, the sciatic nerve is actually the largest single nerve in the body. It's probably about the size of your thumb or your large finger. It's very large, travels from the nerve plexus of the lower lumbar roots down the back of the leg to the knee. When it gets to the knee, it actually splits off into two other nerves, which we won't talk about today. True sciatica or true sciatic pain, typically, as I said, since the nerve ends at the knee, true sciatic pain actually ends at the knee. So if you have pain from the base of the back, through the buttocks, and down to the back of the leg to the knee, typically that's what we call sciatica. If the pain extends beyond the knee, you could still have a sciatic type pain, but that tells us that there's also some nerve root involvement or some involvement higher up in the nerve root. Okay, usually true sciatica comes from the fact that the muscles in the buttocks, the back of the leg, the hamstrings start to tighten up. They spasm, they tighten, they put pressure, they squeeze the nerve. And when they squeeze on the sciatic nerve, it gets irritated, becomes inflamed, and you start to get that pain that travels down to the knee. Okay, sciatica is actually something that's fairly easy to manage and to take care of, because just as you get the inflammation, the secret with sciatica is to kind of settle things down, calm things down. We give you stretches to get those muscles to relax, to take the pressure off the nerve. And once you get that pressure off the sciatic nerve, you let the nerve settle down a little bit. Things start to progress and you get better. Okay, again, if you notice the pain all the way down to the foot, that tells us there's a little more to it. There's probably some lumbar nerve root involvement, and that's a little more involved, but again, can be managed and can be managed well. So if you're having any pain, especially if it's just in like the buttocks, the hip, the buttocks, or down the back of the leg, the upper part of the leg, please come in. It's something we can help you with, definitely, and you'll be glad you did. Thank you, Dr. Del Grosso. You have a great weekend.